And you're welcome. It's time for Wellness Central, the show that brings you expert advice and valuable insights into keeping your mind and body healthy. And so today we're addressing a topic that affects many women, but it's often misunderstood. It's so misunderstood that I went ahead of time to start having that conversation, and you most likely must have heard the snippets of it. It's called bacterial vaginosis. It's a common vaginal infection that can cause discomfort and worry. But with the right knowledge, which we're about to discuss today, and also treatment, it's manageable. And so to help us understand BV better, what it is, its symptoms, and the best solutions, we have with us a special guest joining us today. She is Dr. Ibukunoluwa Yusuf. There we go.
Boy, I'm going to help you out with your Yoruba.
Yeah, I'm struggling with Yoruba. It's no secret.
Okay,
but Ibukunoluwa Yusuf,
Yes.
thank you so much for joining us, Dr.
Thank
Yusuf.
you for having me.
We were having the conversation.
Yes, yes.
And our hot mics were on, and you most likely must have heard it. And I just couldn't wait to have this conversation with you. And it's about bacterial vaginosis, which is also known as BV. So tell us, what is it? How does it differ from other vaginal infections? And you said that it's not considered an SID, which is sexually infectious disease.
Exactly. So the thing with bacterial vaginosis, BV for short, is that what it typically does is that it changes the, let's just say, normal flora of the vagina. So the thing is that there are like normal bacteria that resides there, okay? And this bacteria, they produce acids, and they keep the pH of the vagina acidic, moderately acidic, between about 3.8 to about 4.85, thereabout, pH of the vagina. And then what happens with BV is that there's just this shift, this alteration, like recolonization by whatever other bacteria. They may not be harmful typically, but when they get there, they sort of just shift the whole thing, and then they start to do their own stuff. So yeah, the vagina is there, it is healthy, it's producing its lactic acid, it's just doing its own stuff. And then one random other bacteria that's not supposed to be there just comes in and starts
I'm sorry, doctor, I'm a guy, so I don't really understand. So I would like to know exactly how this manifests when this random bacteria, what is it? Is it a, I don't know.
Philandering joystick that brought it in.
What does it present as exactly?
Exactly. So when this random other bacteria gets in, so number one, it stops the, it reduces the normal bacteria that is there. It sort of like fights for space. And then so when it's reducing the normal bacteria, that one is no longer producing the acid. And this other one is producing whatever. So the pH of the vagina starts to go up.
So when the pH goes up, what does it present as? Is it like, can I visually see that there's something wrong, or can I sense that there's how
like
I sense there's
symptoms.
something?
Yeah,
What are
so
the symptoms?
you will see the, well, not you, the women.
He has a daughter now.
Okay.
Yeah, well, yes, sorry,
yeah,
Mazino.
so
Yeah.
that is the vaginal discharge.
Oh,
it is
discharge.
grayish off-white, and it has this smell. We call it fishy smell. So, I mean, I could walk you through the whole process where that happens, but I mean, I don't want to bore you. But yeah,
it's not
it gives.
boring.
So boring. So boring.
So that is, number one, it starts to increase the pH, and then there is more of this other bad bacteria just floating around, increasing pH, reducing the normal one that's supposed to be there. Then they produce something called amines. So this one, volatile amines, they start to produce the smell. So the discharge plus the smell is what is the typical presentation, or what people typically see when they have BV.
And it's not an SID, you said?
Yes.
You mentioned that.
So, yet. That's the
Yet.
key word.
Gotcha. So I'm watching this, right? And I kind of see the symptoms. I kind of see what you're saying. Or I seem to know a friend or a family member who has this. what is the first thing this person needs to do? Do they first of all go for a test to know that they actually have the BV, or what are the first steps?
Okay, so something very interesting about this BV is, like I said, it is not considered an STI just yet, but because of the presence of this thing, it sort of like lets other stuff in. HIV and other STIs can now colonize because now the vagina is no longer healthy. So it is very important that the person gets tested. Why? Because apart from that, you need to know it is BV for sure. You also need to know if there is any other stuff that is associated with BV so that the treatment is effective. You can treat everything and they go all at once. So you definitely need to go to the hospital and get tested. That test, a swipe of the vagina has to be done. That is now looked at, by the...
I have seen people go online to go and look for quick fixes. I have heard situations where they insert Greek yogurts to asking you to increase your probiotic intake. They've asked people...
Sorry, go back. Greek what?
Greek yogurt. I have seen, look, Mazino, you don't want to know the things that women go through, in this. So I don't know if you know about this. So when, you see women would say, oh, if you, it's all on YouTube. It's all over YouTube. It's on
wrong.
TikTok. Let's ask you, right? What is there's people who go to look for quick fixes to fix their pH, because your pH needs to be at a certain level, and you need to insert Greek yogurts, and you need to drink this and that, and put it into your hoo-ha. So that's another one I heard about cloves. It's interesting.
Oh, wow.
I know. So help us here.
So, I mean, my heart is breaking already. Like, who said these things? I need to get them arrested. I
can pull YouTube videos after YouTube and TikToks after TikToks.
Okay, so, yeah, people need to understand that even if you want to keep the pH level of your vagina, you need like information. You can't just listen to every random person on the internet saying do this or don't do that. I mean, it may work, but it may be disastrous. So I think I was having a conversation sometime. I was somewhere, and I had this like bottle of this feminine wash. So, I mean, I like it. I like the smell. I mean, this has been like a while. I've not had this since. But then I just use it randomly. And then I had this group of women saying, they put it in. Okay. And then, and then in my head, I'm like, did I read the instruction on the bottle wrong? Like, why are you trying to...
Soap.
I mean,
that is
just get a brush, just,
So
so women do these things, and you'll be surprised at how many women actually go ahead and just take information from anywhere. I think there's this bottle, it has instruction on it, you all just have to read it. So the thing is, women put all sorts in, and that is like very wrong. I mean, the normal thing you're even supposed to put in, you still need to be careful with it, talk less of like putting all this other stuff. So for like treatment, you need to like get treatment done. You have to go to an expert. You need to know what is there, what other stuff is there, and then you need to like have it properly treated.
What about those who buy treatment on Instagram as well? There's a whole page that is dedicated to balancing your pHs. People have made millions of it and selling boric acid.
Where do you get this?
Google boric acid.
Yes. So yeah, I want to talk about boric acid.
Thank you.
Suppository. Yeah, they are good. They are helpful, really. They are not treatment. So like every other supplement, you let people know they don't treat. They do not treat. What they do is maintain, keep it healthy, keep it, classy.
First off.
Demure.
Keep it classy, keep it demure, and keep it cutesy. So exactly. So you could couple it with treatments. So once someone is getting treated for BV or any other STI, don't let me say any other STI, because again, BV is not an STI just yet, but the mode of transmission is somewhat related to.
I couldn't wait to get back to that because earlier you said that not yet. It's not an STI yet. When and how does BV become sexually transmitted, if at all?
Oh, so I mean,
Philandering joystick.
yeah. Oh God, no. Okay, so the thing is, studies is showing that even though it is linked to sexual activities, in itself, sexual activity is not the sole cause. So let's say they're testing. So with typical STIs, you treat the partner. If you can get the partner, of course. If you know the partner, you treat the person, treat the partner. And if you don't know the partner, you're advised to use the condoms, So, but with this one, there wasn't much improvement or changes when the person is treated, the partner is treated. They still get the thing. So
that means that person is not right for this thing now.
So it could just be, like I said, other bacteria. They may necessarily not be harmful to any other part of the body, but they could just be lingering around, maybe on the calf, on the, just around, or on the finger, and someone is introducing
my
it. My
brain is doing this thing where it's just coming up with jokes, and I cannot say that.
Don't. So you're saying that it's not introduced into the body. It's by just the sexual member. It could be anything, just by contact, your fingers, your touch, or any exposure to the bacteria.
Dirty fingers, not brushed your tongue, dirty gums, your underwear that is too tight.
Okay.
Most likely?
Yes.
Okay.
Yes, that happens.
So long fingernails that has embedded dirt in them.
And then, men typically think, oh, they're doing something pleasurable. You're changing the pH of your girl.
By introducing.
You're increasing the pH level, and then you're causing whatever other bacteria, they just start getting in.
So habit is a big factor.
I mean, I think we need to talk about
hygiene.
men hygiene in sex. Men are always like, oh, women should be hygienic, women should do this, that.
We're also responsible as well.
Yes, you need to take responsibility as well. You need to keep your partner safe. Wash your hands before sex, wash your thing before sex, just
Use spirit and clean it with cloth.
No, that's not bad. I don't think
scrap
that's
your tongue, brush your teeth, just be clean before sex. You need to do it.
Right.
This is all about food.
I was trying to keep it in, I swear.
Now, if it presents itself, like you have just noted, in in the female anatomy, like so, smells and discharge, how does it present in men, if at all?
It doesn't
present in men.
But you can still transmit it to your partner.
Exactly.
With no presentation.
No, they don't get it. They don't have it.
They don't have
It's bacterial vaginosis for a reason. They don't have it. It doesn't occur in male.
But they can traffic it. They can transmit it.
Traffic. I like that word.
Yeah, because they have not. I'm gonna stop. I won't say anything anymore because I
Mrs.
just.
Can we kick her out now?
Again, I think I need you to sound the alarm on personal hygiene for men. I think you need to sound the alarm for personal hygiene for men, especially those women who continually, because I understand that BVs can be recurring, and you can do everything, change your underwear, and it's still recurring. And maybe someone is watching and most likely just has one partner for the entirety of their lives, but they still have to deal with this thing again. So just again, just sound the alarm and just, reiterate on personal hygiene.
So, I think majority of women already do the whole personal hygiene thing. But men, we need to let you guys know, we need to let men out there know that it is very important. In fact, it is actually super important, more important for them to keep their own hygiene than their partner. So, just be clean before going into sex. Don't come with your sweaty body, sweaty arms. The same mouth you just used to eat pepper soup or or
Just
something,
don't.
and then you just put it there. Please,
Judith just
let's not do
mentioned
that.
something about recurring instances.
Yes,
So for
yes.
women who have recurring instances of BV, how do they take care of that? What do they do? Do you have to change material that you use or change? What do you
Okay.
do?
Yeah. So, yeah, women, when you have BV, you have to wash all your underwear. You could.
How about changing all of it?
Yeah, I mean that could, if you can afford it.
Do you
that
have
could
to
work.
change your partner as well?
Yeah, throw the partner away.
Your partner? Oh, wow.
Throw the entire man away.
Throw the man away.
But what
Very
That
can
could
men
work.
do in that regard as well? While if she presents with BV and says, okay, we have to do something about this, if this is the couple, and it's recurring, okay, fine, she's changing all of her materials, all of her underwear and all of that. As a responsible man, what do I need to do? Do I also have to change my underwear as well?
Yeah, that could be helpful. Although
help.
it's not like necessary for you to do that. You just keep your own hygiene.
Dr. Yusuf is like, oh, that could be awful if you can throw yourself away.
Throw throw, you know, whatever away, whatever.
Mazino has never been left out.
Okay. But really, the boric acid,
Yes.
they help. They really do. So again, supplement, not treatment. So don't use it thinking it's going to treat the BV or whatever else you're having. It won't treat. But with treatment, you can add it, like just to complement the other thing. And then once you take out the bad bacteria, that one can now help your vagina recolonize with the actual bacteria that should be there, and then everything goes back to normal.
Healthy eating, also exercising. When you're sweating, you know, sometimes this area, we sweat there as well. Most people don't know that. Can that also be part of, you know, what would you say to those who go to the gym?
Okay, so I'm a gym girl myself.
I can see now your muscles they're peeping from, look at her bicep. I saw it, it's like, yes, I go exercises.
Yeah, so I'm a gym girl myself. What I have personally done, I mean, I don't think there's any studies about this one, is that to go to the gym, I wear a panty liner. So it just soaks whatever
the
sweat
wetness,
around, and it doesn't get to...
And then when you're using all the other machines, sitting on them wet as well, you know, sometimes you have to
I'm not having direct contact with the machine,
Yes.
so I do
Are
that.
panty liners safe? Because I've heard in many instances that overuse of panty liners can also change the pH of one's.
So number one, I'd like to know where you heard this from. I think we were talking about.
we're talking about
like
this,
so many information out there that
about,
random people. Someone could just set a ring light, and then just say whatever, and it's on the internet, and then you Google something, and that's the information you see. So number one, I'd like to know where the source of this information.
I can't recall currently, but I'm pressed. I'm not allowed to tell my sources. I'm joking. But it's news. It's word around. People tell it all the time. I'm sure.
Yeah, I've heard it. Yeah, we had that conversation in the makeup room as well about you know, that being bad.
So is it true or not?
Okay, so it is not bad. So when is it overuse? I don't know what they mean. Is it?
Should you use it every day, for instance?
Okay, so I don't use it every day. They're just some days, and then for a couple of hours. In one day,
I use mine. That's too much of personal information, but I think that I use mine closer to the cycle. You know what I mean? Because I feel like getting closer to the cycle, you have more of that moist going on, so you have to do that to get more dry. So I think that's what.
So whatever helps, whatever gets it going. So I just like to, again, I said, going to the gym, I don't like direct contact with anything. Even though I clean everywhere before I still like, no, let me just protect myself. So yeah, you could use it for a couple of hours in a day, maybe not every day.
Yeah.
On when you feel like you need to. So,
just extra dryness.
I mean, there's no need to use panty liner every day.
At all.
There's definitely no need for that. So once in a while, when you feel like you just want that extra protection, you definitely could go ahead and use a panty liner.
Yeah. Yeah.
I will remember that.
Yeah. Oh, yeah, Mazino said, remember that. But anyway, Dr. Ibukunoluwa Yusuf, there we go. She's a medical doctor and she joined us today to talk about a very important conversation that women might be shy not to want to talk about this. They're afraid of it. They don't think it's important. But remember that having these conversations and open platforms like this is important so that you can be able to identify what's wrong and see a doctor and be, comfortable.
And thank you for making it easy on
so
the ears with a little, little spice of humor there.
Yeah.
Made it easier to listen to.